It's almost 2026, and I want to tell you what is on my cancer wish list for the new year. So, thinking of drugs, research studies, research priorities that I hope we'll see more of in 2026 for both breast and gynecologic cancers. Number one, I would love to see more survivorship research, both for patients who have gone through cancer treatment or are going through cancer treatment, including patients who are living with metastatic cancer. We have done a lot this year in terms of thinking about survivorship, but we have a long way to go. We are talking about vaginal hormones. We're talking about vasomotor symptoms, hot flashes, night sweats. Are seeing more research using menopausal hormone therapy, but I really want us to take this to the next level, focusing on living your healthiest life during and after cancer. Focus on longevity, how to take care of your symptoms in the short run and bones, your brain, your heart in the long run, your mental health, sexual health, you name it. I want to see more of it. Number two, this goes without saying, but we need more research for metastatic cancer. This year in breast cancer, we've actually had significant strides for HER2 positive, hormone receptor positive, triple negative, really remarkable studies, the Ascent trials, Tropion Breast 02, Destiny Breast 09, Serena 6, I can go on and on. But now we want to see some of these approvals. We want to see more research. We want to start thinking about sequencing and optimal sequencing of a lot of these medications in metastatic cancer to try to improve outcomes. Number three, I'd love to see more vaccine trials and perhaps, and I think this one's a little far off, but in the future, a vaccine approval. I think that's so important. And I think that the research is making strides and we want to see more of that. And that means funding that research. Number four, I'd like to see more data research, perhaps a drug approval for SERDs in early stage breast cancer. So we saw the results of the lidERA trial, which is the selective estrogen receptor degrader, giredestrant, in early stage breast cancer. And that would take the place of endocrine therapy with tamoxifen or an aromatase inhibitor. Not FDA approved yet, but maybe in 2026. And I do want to see the results of other ongoing SERD studies in early stage breast cancer. Number five, we've had a lot of new drugs that are coming out in gynecologic cancer, selinexor for endometrial cancer maintenance, relacorilant for ovarian cancer. There are novel antibody drug conjugates, and I'd love to see some drug approvals so we can actually use these medications in gynecologic cancer. Now, these are all treatment related, but I would love to see more research into understanding why people are getting cancer at a younger age and how we can change that. Continued research into understanding optimal screening ages, modalities, and a focus on financial toxicity. Because if people can't afford healthcare, they can't afford to get screening, they can't afford to pay for their treatment when they need it. And it is more important now than ever. So that's what's on my wish list. Share yours.